especially the UPSOS Society and the AIOS Society for having given this opportunity. So I will be speaking on the long-term results of adjustable frontalis suspension surgery, sling surgery for various types of ptosis. I have did many times live demonstration in Gorakhpur annual conference, also at UPSOS and at Allahabad. And so I will be presenting the long-term results of my case, and I will be, because the time is short, I will just be showing an animated video. So surgical management of ptosis still remains a challenge, because at the time of surgery and the final results, there can be a lot of difference. And the reasons for not achieving a desired height is whenever you give a local anesthesia, there is some amount of edema which is there. In general anesthesia, you cannot correlate with the other eye. The patient is lying in the supine position, there is a lid swelling, and there is a lot of anxiety of the patient in the operation theatre. So we are hereby describing a special technique, that is adjustable frontalis suspension technique by myself. And it's a retrospective design. So in our study, we operated a total of 182 cases, and out of them 160 who had a follow-up of minimum of 1 year were taken in this study. The study was performed at Netrodaya, CHANDRA Eye Care, and at BHU from 2007 to 2022. And almost all varieties of cases, that are congenital ptosis, blepharophimosis syndrome, traumatic ptosis, third nerve palsy, myasthenia gravis, CPEO, Marcus gun, aponeurotic, tumor resection, everyone was taken. So I'll just go on to the video. So how we do it. So this is an animated video. So we mark 2 incisions here at the lid crease, then 2 at the brow and 1 at the forehead. And then we pass oro sling, which is from Oro Lab, from the top incision in a Fox pentagonal method. So we start from the top, go to the nasal brow, and then we come to the lid, and then we pass on to the other side, and then we again go to the brow, and then we come out from the main incision. So this is a normal Fox pentagon method. So what deviation we have made is, after we come it from here, there is a Watkins sleeve which is attached in that Oro sling. So we pass the sling in the opposite direction, and then from the opposite direction again we pass it sub beneath the muscle, and then we take out from the other sides. So you can see we have not tied it anywhere. We have just passed to the Watkins sleeve, as Dr. Varis or all the retina surgeons have been doing with the retinal sling, and then we have taken it from the other side. Now what will happen on the I will just go a little back. So and we leave it like that. So we do not correct the ptosis on the first on the table, and on the next post-operative day, when the patient is on the sitting position, we pull both the green, which is mentioned here as green, and when we'll pull both the green strings together, this lid will elevate, because this is in a form of an 8. So when we'll pull both the strings, this lid will elevate, and then we can have the exact desired size as compared to the other eye, or maybe slightly more on the next post-operative day. The other thing is, if there is a slight change in the contour, for example, let's suppose the temporal is slightly lower, the nasal is slightly higher, you just pull the nasal side. So when you will pull the nasal side, the temporal lifting would be there. So you can also manage difference of the contour via this technique. So I'll just conclude by the results, which what we got was, because the time is short. So these are the pre-op and post-op photographs. You can see we have photographs of almost all the patients. And at the end of 1 year after surgery, desired lid height was achieved in 152 of 160 eyes. Till the completion of the study, 136 eyes achieved good elevation and did not require any further surgeries. Resurgery was required in 16 patients from 1 month to 10 years follow-up. So if there is a patient who comes 10 years after the surgery, you don't need to repeat the whole procedure. You just need to open the superior incision, take out the Watkins sleeve, just tighten it, and put it back again. So it's a very, very simple procedure, and the whole surgery need not be repeated. And 8 patients in this study had mild ptosis, but they did not give their consent for further surgery. So there were very few complications. The most common complication was undercorrection in 20 out of 160, and out of them we operated again on 12 patients. So the advantages are that the adjustment is done on the next day without the effect of LA or GA, without any lid swelling, in sitting position with both eyes open in consultant chamber with the patient attendant there itself. So they can also make a judgment that you want to lift the lid a little more or you want to let it be there. And can it be done at a later date, maybe 1 week or even 10 years after the initial process has taken place. And as I told you, temporal or nasal shifting can also be done. So thank you. This is a very innovative technique, and we are under publication also. And I hope this would be published in a very good journal. Thank you. Yes, madam.
So the sling is lying. So
yes.
How long will it lie, and how?
So normally the next post-op day, we just pull the sling after we have adjusted the height and cut it. So the sling retracts back. And
we don't need to suture it?
No, nothing.
It will not slip away?
No, never.
Really?
I have done 160 cases.
Because when
I have all the videos.
Okay.
Yes. It's like a Watt's sleeve, what you put in retina buckle. So you don't need to tie that after you have put the Watt's sleeve.
Normally भी करते हैं frontal जो severe ptosis में when we do the frontalis suspension, this is what it is you have showed.
Yes.
But उसमें भी सर suture लगाते हैं because there is always a risk of slipping it.
No, वहाँ तो
rolling suture लगाना पड़ता है.
वो तुमको tie करना है. tie नहीं करेंगे तो कैसे होगा? यहाँ पे आप स्लीव में डाल देंगे.
आपने ऐसे पास करके और वापस निकाल दिया और उसको टाई भी नहीं किया.
तो वाट्स के स्लीव बहुत टाइट होती है, वो उसको पकड़ा रहेगा.
जो स्लिंग के साथ आती है वही स्लीव की बात कर रहे हैं ना?
Exactly.
अच्छा ठीक है. जो बैंड बकल में यूज होती है that is different from what we get with the oral.
In oral sling there is a Watt's sleeve there in the
होती है सर, उसी को यूज उसी से टाई करते हैं.
हाँ, तो उसी को opposite direction में पास करना है. Normally what you do you pass in the same direction.
And then tie and then we bury it.
Yes. तो यहाँ पे you pass in the opposite direction and then you just leave it. It will never slip.
करके देखना पड़ेगा. तो यकीन नहीं होगा. Difficult to believe.
Yes, yes. It's slightly different. हाँ, उसमें तो हम लोग को हटाना पड़ता है. इसमें हम लोग अगर पुल कर देंगे तो वो हो जाएगा.
Since we are
we will have more time in our UPSOS session.
Yes. We will move to the next.
Abdul.
Sir.
जैसे आपका innovation है, तो I think UPSS जो innovations कर रही है, we should highlight it at the national platform.
So we are
and
going
I think
to
hats
have
off to both of you, sir.
We are going to have innovation session on day 6, day 4. That's an innovation session which has been given to us. But अभी क्या है कि हम लोग इसको और highlight कर सकते हैं. Dr. Sakshi.
Should be highlighted.